Welcome to my channel, Easy Anatomy and Physiology. Today we will discuss about heart. We will see some external features today. So what is heart? Heart is a conical hollow muscular organ situated in the middle mediastinum. The size of heart is about one's closed fist, right? Enclosed in a double sac of pericardium, that is outer fibrous and inner serous. It has four chambers: right atrium, right ventricle, left atrium, left ventricle. So, what is the importance of heart? Look, there's a total amount of blood in our body, there's 5.5 liters, but it has to do tremendous function, right? From the birth up to the death. So blood must circulate in order to get rid of waste product and addition of oxygen. So the function of heart is to circulate blood by pumping action. Right? So now we will see just a position of heart within the thoracic cavity and the fourth orifice. This is the position, the fourth APTM, the fourth orifice. APTM, that is aortic orifice. This is the aortic orifice. This is the pulmonary orifice. This is the tricuspid orifice, and this is the mitral orifice. It is the relation with the lungs, how it's situated. Right. You can see the first, second, third, fourth, and fifth ribs. Now let's discuss about the external features. Right. So the first of all, apex of the heart. Right. I have to lower the cursor, but I can't. So you can see. 1 minute. This is the apex, right? The apex of heart, pointed, formed only by the left ventricle, directed downwards, forwards, and to the left, 9 centimeter away from the midline, just below and medial to the left nipple. The apex beat, that means downmost and outermost point of definite cardiac pulsation, is palpable. Right? Now the base. Base of this is the posterior view. This picture is taken by Atlas of Anatomy of Neter. Formed solely by two atria, that is right and left. So we have to remember the base of the heart is also called the posterior surface. It is formed mainly by the left atrium and by a small part of the right atrium. Okay. In relation to the base, one can see the openings of 4 pulmonary veins. What are the 4 pulmonary veins? Superior, so right superior, right inferior, left superior, left inferior pulmonary veins, which open into the left atrium, and of the superior inferior vena cava, which opens into the right atrium. Right. Clinical aspect of base is very much important. Corresponding to parasternal part of right second intercostal pairs examined by auscultation. So you have to remember the base, you can correspond to the parasternal part of right second intercostal space examined by auscultation. Another important aspect of the apex of the heart is the case called dextrocardia. In dextrocardia, the apex is on the right side, right? Basically, the cardiac apex or the apex beat is on the left side, right? Okay. Now let's see the sternocostal surface formed by of aortic valve, right ventricle, that is 2/3, right atrium with auricle, and 1/3 of the left ventricle. Once again, to repeat, formed by aortic valve of right ventricle that constitute 2/3 of the sternocostal surface, right atrium with auricle, and 1/3 of the left ventricle. Is it clear? I hope it is clear to everyone. Again, now the surface is covered by lungs and pleura except the area called cardiac dullness. It is helped in the percussion when if there is excess fluid in pericardium, it is drained through this area, right? Now the groove lodges two important artery and sinus, right? That is the how can you remember this? Because the groove present in this surface is called anterior interventricular groove, and the groove lodges anterior interventricular branch of left coronary artery and great cardiac vein. Left coronary artery and the great cardiac vein. This left coronary artery and great cardiac vein. Hope it helps you. This diaphragmatic surface, it is formed by 1/3 by the right ventricle and 2/3 by the left ventricle. It is formed by right and left ventricles. How? 1/3 by the right ventricle and 2/3 by the left ventricle. Right? So it is flat surface rests on diaphragm. So you can understand why the surface name called diaphragmatic surface. The surface present posterior interventricular groove which lodges right coronary artery, that is right coronary artery and medial cardiac vein, the medial cardiac vein. Okay, so it is very easy. And there is another surface, that is left surface, formed by left auricle and the left ventricle. Now it is the base and diaphragmatic surface of the posterior view. You can see now the borders. This is the right border of the heart, this is the inferior border of the heart, this is the left border of the heart. Right border separates sternocostal surface from the base. Once again, right border separates the sternocostal surface from the base. Okay, it extends from right side of the superior vena cava to inferior vena cava. From the right side of the superior vena cava to the inferior vena cava. It corresponds to sulcus terminalis outside. Left border left border, it is formed mainly by left ventricle and partly by left auricle. Each borders form angle with diaphragm called right and left cardiopharyngeal angle. Okay? Each borders formed angle with diaphragm called right and left cardiopharyngeal angle. Left border separates sternocostal surface from left surface. And the last one, inferior border that separates sternocostal surface from the diaphragmatic surface, formed mainly by right ventricle, partly by left ventricle near its apex. Medial to the apex lies a notch that's called insula apicis cordis. Insula apicis cordis. At this border lies right marginal vessels. Okay? Right marginal vessels. So this is the thoracic organs of heart, lungs, ventral aspect. You can see one is the aorta. This is the aorta. This is the pulmonary artery. This is the right heart. This is the left heart. And the 5 is diaphragm. So that's all for today. We'll discuss later about the right atrium. Thank you.